Today is the first day restaurants and gyms can open at full capacity as the Ford government officially begins to ease further out of restrictions. But their plan to drop all public health measures by March is being heavily criticized tonight.
It seems foolish. It seems ignorant even to sort of peg a date right now when there are so many unknowns. It reflects a lack of thinking, a lack of planning.
On Friday, Premier Doug Ford announced proof of vaccination could be lifted in restaurants, bars and sporting events by mid-January. And by the end of March, it could be eliminated in all settings and indoor mask mandates dropped. Epidemiologist Colin Furness warns the government is undermining Ontario's progress.
We cannot seriously forecast that far into the future at all. When you announce that there's going to be an end of vaccine mandates, you really are signaling to people who are resisting getting the vaccine that they should continue resisting. And that's actually incredibly counterproductive. The only reason that Ontario is not on fire with COVID right now is because of vaccination.
Even the health minister acknowledged today giving an end date to proof of vaccination could encourage vaccine hesitancy.
That is an issue, of course, but I think that people that are not intending to get the vaccination, the specific date isn't going to really make that much of a difference to them. This is our plan going forward, but it may be subject to change.
At what point?
Question.
At what point is this government going to listen to nurses, repeal Bill 124, and make vaccinations mandatory for frontline healthcare and education workers?
During question period, the government was asked again today to make vaccines mandatory for frontline healthcare workers, which the Science Advisory Table is recommending. The Premier, who has been reluctant to impose mandates, says he's worried about losing more workers.
And the reality is that right now, we're already down 15% healthcare workers.
The health minister signaled an announcement on mandatory vaccines could be made by this Friday. However, a short time later, a spokesperson sent an email out stating a decision will not be coming this week. The bottom line, according to Colin Furness, is to remember COVID is unpredictable, not only in Ontario, but around the world.
We also have a lot of uncertainty about waning immunity from the vaccination. So, vaccination is cumulative, but it might wear out. It has in Israel. It's hard to compare the two because they did their vaccination differently. And so we can't be automatically sure that it's going to be one way or the other. But we have to be paying attention to that and watching that.
Back to vaccine mandates, Doug Ford asked hospitals and health partners for input on whether to impose them on healthcare workers almost 2 weeks ago. He still hasn't made a decision, and if one isn't coming this week, well, next week it's going to be November. The Liberals are accusing the Premier of dithering. Ultimately, he's going to have to make a move.